A 72-year-old patient once leaned in during a quiet moment in my office and said, "Doc, I've been doing it the same way for over 50 years, but lately something just feels wrong." He wasn't sick. He hadn't started any new medications, but something subtle and silent was shifting in his body, and he couldn't figure out why. The answer. It wasn't what he was doing, but how he was doing it. A private routine he thought was harmless, even healthy, was slowly taking a toll on his heart, his prostate, and even his ability to feel pleasure. And he had no idea. I'm Dr. Mohit, a urologist with over 60 years of experience helping men over 60 stay strong, confident, and sexually healthy without shame pills or guesswork. Today I'm going to reveal the 7 most common masturbation mistakes older men make and how to correct them before they quietly damage your performance energy or long-term health. If you're a man over 60 or care about one, this is a conversation you've likely never heard, but absolutely need to. Stay with me until the end, because mistake number 6 is one that nearly every man gets wrong, and it could be sabotaging your intimacy in ways you don't even realize. And before we dive in, take a moment to subscribe and turn on the notification bell. That way you won't miss any future advice made specifically for men navigating strength, vitality, and sexuality beyond midlife. If what you hear resonates, type 1 in the comments. If not, type 0. Your feedback helps me make this content better for you. Let's begin. Mistake number 1. Using porn as the primary stimulus. Over the years, countless men, usually in their late 60s or early 70s, have sat across from me quietly frustrated and confused. "Doctor," they say, "I just can't feel much anymore. It's like my body's going numb." My first question is always simple. How often do you use pornography? And almost every time their eyes drop, not from shame, but because it's the first time they've considered it might be doing more harm than good. Here's what's happening behind the scenes. As we age, our brain's dopamine system, the same system that handles pleasure motivation and emotional connection, loses some of its sensitivity. When you repeatedly expose it to high-speed, high-intensity adult content, you flood it with more stimulation than it was designed to handle. Your brain adapts, but in the worst way possible. It starts to numb itself. That means the things that once sparked joy, gentle touch, intimacy, connection, start to feel dull. Touch doesn't register the same way. Arousal becomes delayed or absent. Even when your body is healthy, your brain no longer responds the way it used to. And tragically, many men blame themselves. They think, "I've just lost it with age." But in most cases, it's not age, it's overstimulation. It's habit. It's exposure to extremes that the brain simply can't match in real life. If you've noticed a drop in sensitivity, a fading connection to your body, or a lack of satisfaction in intimacy, don't ignore it. This first mistake might be at the root. So what can you do? Reset. Step away from digital content. Focus on sensation rather than stimulation. Give your nervous system time to reconnect to real, grounded, slow experiences. You'd be surprised how quickly the body remembers when the brain is no longer overloaded. Mistake number 2, masturbating while sitting on the toilet. This one catches most men off guard. On the surface, it seems harmless, even practical. Over the years, many older men have told me, "The bathroom is my private space. It's quiet. The door locks, no one interrupts me there." But what seems convenient could actually be quietly undermining your health. Why? Because as men age, circulation becomes absolutely critical. Blood flow is the engine behind sexual performance, prostate health, and recovery. But when you sit for long periods, especially hunched over on the toilet, you restrict blood flow to the pelvic region. You put pressure on the prostate. You tighten the pelvic floor. And over time, that strain damages nerves and vessels already more vulnerable with age. I've seen it repeatedly in clinical practice. Men in their 60s and 70s who experience groin discomfort, difficulty fully emptying the bladder, post-urination dribbling, loss of sensation during intimacy. And they rarely link it to this private habit. But as a urologist, I've reviewed the scans, seen the blood flow patterns, and tracked the symptoms. The connection is clear. So what's the fix? Simple awareness and a change of environment. Instead of sitting, try reclining or standing. Give your pelvic region room to breathe and circulate. You don't have to abandon the ritual, just change how and where you do it. Your prostate will thank you. Mistake number 3, rushing the experience. Now let's talk about something that almost every man does, but few realize the cost. And that's rushing through self-pleasure. In our next segment, I'll explain why this one habit born from years of stress, secrecy, and speed may be rewiring your body to feel less every time, and how slowing down might be the single most powerful fix of all. We just uncovered how using porn can numb your brain, and how your environment, even something as common as the toilet, can silently damage your body. But what if the problem isn't what you're doing, but how fast you're doing it? Mistake 3, rushing the experience. Many older men treat masturbation like a task on a checklist, something to get over with rather than something to be present with. I hear it all the time from patients. Doc, I don't have time to linger. I just want to get it done and move on. But here's the problem. After 60, your body no longer thrives under pressure, literally or emotionally. What once may have felt efficient is now working against you. When you rush, your nervous system doesn't get a chance to settle. Your heart rate spikes too quickly, your blood vessels constrict, and the release of feel-good hormones like oxytocin, dopamine, and serotonin is cut short. Yes, you may reach climax, but you miss the reward. You finish the act, and instead of feeling satisfied, you feel more drained. Instead of feeling relaxed and connected, you feel emotionally flat, maybe even a little hollow. Over time, this rushed pattern teaches your body that pleasure is something shallow, fast, disconnected. Your sensitivity dulls. Your ability to hold arousal weakens. You struggle to stay engaged during intimacy with a partner, and all the while you may chalk it up to aging. But it's not your age, it's your habit of urgency. This pattern robs you of something far more meaningful than just a few moments of pleasure. It trains your body to disconnect from feeling. It tells your brain that speed equals satisfaction, even though your nervous system is quietly begging for slowness. So what's the solution? Slow it down. There's no finish line, no stopwatch. Give your body space to feel. Let the experience unfold without a goal. Focus on your breath. Notice sensation. Be curious again. You might be surprised to find that beneath the numbness is a deep well of feeling still waiting to be accessed. Your body isn't broken, it's just been rushed. Mistake 4, ignoring the pelvic floor. Now let's shift to a part of the male body that almost no one talks about, but is absolutely essential after 60. Your pelvic floor. Most men haven't heard of it. Yet it's the hidden foundation that supports nearly every part of male sexual and urinary function. This group of muscles sits beneath your bladder, behind your prostate, and wraps around the base of your penis. It controls erection quality, orgasm strength, and even your ability to fully empty your bladder. And when it weakens, which it often does with age and disuse, the entire system begins to falter. Let me tell you about one of my patients, Jack, a retired athlete in his late 60s. He ate clean. He exercised regularly. But he came to me saying, "Doc, something just doesn't work like it used to." Jack didn't realize that after decades of sitting holding in stress and unconsciously clenching his lower abdomen, his pelvic floor had gone dormant. He had lost connection to that part of his body. And because of it, his erection strength faded, his orgasms became weak and post-urination dribbling became frequent. What's more, many men worsen the problem without realizing it. When they masturbate without awareness, or worse, when they strain, bear down, or tighten during release, they create pressure that damages the very muscles meant to support them. Over time, this leads to decreased erection quality, reduced sensation, leaking or urinary hesitation, a decline in confidence. But here's the good news: these muscles can be retrained. A simple practice, gently engaging the muscles you'd use to stop the flow of urine during arousal, can build awareness and control. With time, this not only strengthens physical function, but also restores mental confidence and emotional presence. And speaking of presence, let's talk about how often you engage with this part of your life, because too much or too little can throw the entire system off balance. Mistake 5. Frequency that's too high or too low. Now, this is a topic many older men struggle to bring up. Some wonder if they're doing it too often. Others silently question if they've gone too long without. And somewhere between shame, uncertainty, and outdated beliefs, many end up confused and disconnected from their own bodies. Here's what I've seen in practice: both extremes can be harmful. When a man masturbates too frequently out of habit, boredom, stress, or unresolved emotions, his body begins to push back. Energy levels drop, prostate tissue becomes irritated, recovery time increases, and over time desire starts to fade, not because he doesn't care, but because it becomes mechanical. Routine overtakes intimacy, stimulation replaces connection, and the nervous system bombarded with repetition becomes dull. On the other hand, complete abstinence can be just as problematic. Some men stop altogether due to medications, chronic illness, guilt, or the belief that sexuality has an expiration date. But what they often don't realize is that the male sexual system needs regular circulation. Even arousal without climax helps keep blood flowing, maintains nerve health, and preserves erectile function. When it's gone for too long, atrophy sets in. Desire shrinks, sensation fades, and the door to connection, physical and emotional, can quietly close. So what's the ideal frequency? There's no one-size-fits-all answer, but for most men over 60, 1 to 2 times per week, done consciously and with care, is often the sweet spot. It maintains hormonal rhythm, supports prostate health, and keeps the system responsive without burnout. This isn't about setting rules, it's about listening to your body. And your body at this age speaks softly. The question is, are you paying attention? But even if you get frequency right, there's one more habit, one nearly every man I see is guilty of, that may be doing silent, long-term damage to your body. It's not about how often you touch yourself. It's about how hard you do it. Coming up next, mistake 6, using too much pressure or force. And once you understand this one, it could change the way you feel for the rest of your life. We just explored how frequency, the how often, can either nourish your body or quietly drain it. But even if you get that part right, there's one mistake that can silently undo all the progress. It's not about how often, it's about how hard. Mistake 6. Using too much pressure or force. Some of the most common phrases I hear in my clinic are, "Doc, it doesn't feel like it used to," or "It takes more effort than ever." Behind those simple admissions is often a deeply overlooked habit, using too much pressure during self-touch. It's a silent adaptation most men don't even realize they're making. As sensitivity starts to decline with age, the natural instinct is to grip tighter, press harder, or increase intensity in an effort to wake things up. It makes sense you're chasing the feeling you once had, but here's what your body is quietly trying to tell you. Force does not restore sensation. It destroys it. The nerves in the penis are delicate, especially in your 60s, 70s, and beyond. With age, the tissue becomes more vulnerable. Years of aggressive friction, tight gripping, or using rigid surfaces or devices with excessive pressure can lead to real long-term damage, micro tears in the tissue, loss of elasticity, reduced blood flow, nerve desensitization, and even hidden scarring beneath the surface. In some men, this leads to curvature, a condition called Peyronie's disease, difficulty achieving full erections or discomfort during arousal. And the worst part? It doesn't happen all at once. This kind of trauma builds slowly, silently, day after day, year after year. By the time the signs become clear, reduced sensation, delayed arousal discomfort, it's already well underway. But it's not just about the physical effects. When a man starts fighting for pleasure, he begins to disconnect from it. The experience shifts from something nurturing to something strained. And over time, the brain stops associating touch with comfort or joy. It starts associating it with struggle. That mental pattern alone can rewire your body's ability to relax, receive, and feel. So what can you do? Take a gentler approach. Lighten your touch. Slow down your rhythm. Think of it not as a task, but as a way of communicating with your body. Respect what it can still feel, even if that feeling is more subtle than it used to be. Your body still wants to feel. It just needs you to change how you listen. And speaking of disconnection, there's one final mistake many older men fall into. One that has nothing to do with technique and everything to do with the heart. Mistake 7. Masturbating without emotion, connection, or intention. This is the most invisible mistake of all, and perhaps the most heartbreaking. It's not about what you're doing, not about how often, not even about where. It's about how you feel when you do it. Over time, many older men begin to treat self-pleasure as routine, mechanical, a quick escape from loneliness, a habit stripped of emotion, meaning, or intention. It becomes something done in silence, not celebration, out of habit, not desire. I've sat with so many men, strong, wise, honest men in their 60s, 70s, and beyond, who say the same quiet thing. It doesn't feel like it used to. Or worse, I don't even know why I bother anymore. It's not because their bodies no longer function. It's because their hearts aren't in it anymore. There's no presence, no warmth, no real connection to the experience. And that kind of emotional absence takes a toll physically and mentally. When self-pleasure becomes detached from emotion, the nervous system starts to expect pleasure without purpose. You might still climax, but your body doesn't release the same healing hormones. You don't get the oxytocin that boosts connection, the dopamine that sharpens focus, the serotonin that soothes stress. Instead, you're left with emptiness, a shadow of what the experience once was. And worse, it reinforces the idea that pleasure is something you do alone, in silence, with no meaning. But it doesn't have to be that way. Even solo touch can be sacred. It can be mindful, healing, affirming. It can be a moment to reconnect not in shame, but in gratitude. Your body may have changed, but it still belongs to you. It still feels, it still matters. The bigger picture, reclaiming your connection. Now that we've explored all 7 mistakes, let's zoom out and look at what they all have in common. Because what we're really talking about here is connection. Over the years, I've watched too many good men blame aging time or themselves for changes in their bodies. But the truth is, no one ever taught us how to age with awareness, especially when it comes to sexuality. These mistakes don't come from ignorance or laziness. They come from doing what once worked without realizing the body like life evolves. Slower circulation, a more sensitive prostate, a nervous system that no longer tolerates force or disconnection, a heart that craves meaning, not just sensation. Let me be clear, there is nothing shameful about touching yourself. There is nothing shameful about seeking comfort, joy, or relief. The danger is when we stop paying attention, when we stop feeling, when we assume the same old habits will carry us forward. Every one of those mistakes, overusing porn, bad posture rushing, ignoring the pelvic floor, poor frequency, too much pressure, emotional disconnection has one root cause. Disconnection. That's the true enemy, not age. And the path forward is reconnection. Not just to your body, but to your spirit, your wisdom, and your worth. You're not too late. You're just in a new chapter. Your body is still talking to you. Even if it's quieter now, even if it takes longer to respond, even if it feels different, it's still alive. And it's still yours. Like a classic car, it may need gentler handling, more maintenance, more care. But that doesn't make it broken. That makes it sacred. So what do you do now? Start small. Be slower. Be kinder. Let curiosity replace shame. Let mindfulness replace routine. Let presence replace performance. You don't need to be who you were. You need to honor who you are. And I've seen it firsthand, men in their 60s, 70s, even their 80s, rebuild their health, restore their vitality, and reconnect with their bodies, not because they were perfect, but because they chose to pay attention. You can too, because your best years aren't behind you. They're in how you live now, with care, with dignity, and with quiet pride, even in the most private corners of your life. If this message resonated with you, please like, subscribe, and share this with another man who might need to hear it. And if you're still here, type respect in the comments to let me know you're watching, because your journey matters. Thank you for watching. I'm Dr. Mohit Kara, and I believe in your next chapter.